Treatment for opioid addiction. It can be scary, it can be overwhelming, so where do you even begin? Insider Dr. Daniel Bober says it all starts with healthy communication. What is the best way to encourage help without being judgmental?
So there's this concept, this type of therapy called motivational interviewing, and the concept is not to be direct, not to
almost be passive aggressive,
right, to not put people on defensive and say, hey, what's your problem? You know, you're nodding off. You know, you're drinking too much, or what are those pills that you're taking? You know, you need to, I think, take a much softer approach and try to give the person some degree of insight. You know, before you get in their face and become confrontational, because that will just cause them to shut down.
Completely. Exactly. So what's motivational interviewing? Can you give an example?
So motivational interviewing would be, you know, if you come in and you smoke a lot of marijuana, instead of saying, hey, you know, I think you clearly have a problem with marijuana, you would say, let me ask you something. What does this marijuana do for you? Like, what are you getting out of it? And be sort of curious and leave it open-ended instead of being confrontational and in your face.
Now, when someone is ready for treatment, at what point are they seeing their primary doctor? Are they going straight to rehab, like how we see in the shows? What's involved?
It depends to what degree they're impaired. You know, if sometimes there's a type of treatment called buprenorphine, which falls under the category of what we call opioid substitution treatment, which means that someone can come to me in my office in anonymity, and I can prescribe them a medication that will reduce their cravings and allow them to function in everyday life. So not everyone needs a residential treatment facility 24/7 monitoring. Some people can do it as an outpatient.
Right. I have a question about these opioid substitutions, as you've mentioned, methadone being one of them, this new drug. Is it almost an addiction now to something else that may not be the opioid? Because it seems like now you're just dependent on something else.
I'm actually glad you said that, because that is one of the most controversial topics in the recovery community. Exactly what you just said. And here's the thing. People say, well, if you're using methadone or if you're using a drug like buprenorphine, then you're just substituting one addiction for another, right? You're not truly clean. But this is why that's not true.
Okay.
If you're using a drug like methadone, you're using the same amount generally every day. You're finding a stable dose and you're staying on it, and you're able to function. You're able to work. You're able to engage in social relationships. It goes back to what I said in the beginning of the program about the difference between addiction and dependence. Sure, you may need the drug every day and you can't stop it abruptly, and maybe you need to be weaned off, but you're not addicted to it because it's a measure of functionality. You're still going to work every day. You're still doing what you need to do and meeting your responsibilities. So it's not addiction, and it's not the same thing as if you were back on heroin again.
Okay, thank you for clarifying that. And for more severe cases, patients may be placed in residential treatment. And this is what you were talking about. Depends on the severity as well. So what does a residential treatment or program involve?
So generally it involves, medication, like we said, opioid substitution treatment, individual therapy, family therapy, group therapy in a structured 24-hour setting where the person is monitored. And this is very often happening after they've basically let everything go. Now they've been fired from their job, maybe they haven't paid their rent, maybe their family has cut them off and basically said, you either get into treatment or you are on the street and you are homeless, and we are cutting you off unless you get help.
I feel like there are many people that would want to get help but probably can't get help because let's be honest, these residential treatments aren't cheap, and some aren't covered by insurance.
Very expensive, and this is what I tell people all the time. I work in a rehab for people that come from means. Their family has money, and I said, you have no idea how lucky you are to be here, because you could be in the gutter and on the street, but you have a family that's willing to put all these resources for you to get help.
Now, there are some withdrawal symptoms as well to look out for when you have addiction or weaning off from your addiction. So how long do they last, and what are some of these withdrawal symptoms?
So it depends on the type of opioid you're using. The longer acting opioids will take longer for the withdrawal symptoms to come out. But for example, heroin, you're going to see, these withdrawal symptoms, 12 to 24 hours in, and they probably will peak at about 36 hours.
Wow. And these almost seem like extreme flu symptoms.
That's what it really is. It is like a flu. And there were some these videos from the 70s of people kicking and unable to sit still, and that's kind of what it is. Like, you can't find sort of an uncomfortable spot in your head. Like, you're always shaking, you're sweating, you're vomiting, you have diarrhea. Generally opioid withdrawal won't kill you. It won't make you die, but it'll make you feel like you want to die.
Right. Now, because it's so intense, you have to be under medical supervision while you're going through withdrawals?
Again, if you're a young, healthy person without what we call comorbid medical conditions, you probably will survive it, but there is treatment. You can take medications to help take the edge off.
Wow, that's unbelievable to me. But it also means that people can relapse, though, right? Because of that intensity?
That's the greatest chance of relapse, right, when they stop, right? Because that's when the cravings become so intense that they will literally do anything to get the drug.
And to free themselves from this uncomfortable pain.
It's not about feeling good, it's just about not feeling bad.
Not feeling bad. Now, I'd like to remind our viewers, if you have a question for Dr. Bober and about opioid addiction, you can call in using the toll-free number, 855-796-4475. Now, like we mentioned earlier, one of the scariest parts of the opioid epidemic is the alarming number of overdose deaths. Now, the World Health Organization uses a combination of 3 symptoms referred to as the opioid overdose triage. Explain these symptoms, and what does that mean, this overdose, this triage?
So these are the signs of an overdose, essentially. If you come upon someone on the street, very often they seem like they're either unconscious or their breathing is slowing down. And you'd contact paramedics, they will give a drug called Narcan, which is a drug to help reverse an opioid overdose. And it really cannot not do any harm if you give it, even if the person hadn't used opioids. So it can only help, it really can't hurt. So that's the first drug that paramedics will give to try to reverse it.
And please remember, there's always help available. Don't hesitate to reach out and find support. That does it for us today. If you want to watch more videos like what you've seen, I know you do, download the Health Channel app and visit our website, allhealthtv.com. Also follow us on social media. We're everywhere, Facebook, Instagram, Twitter, at AllHealthTV.